Well, good afternoon, everyone, and welcome to today's briefing on the status of COVID-19 in Illinois. Before I move to our update today, I want to take a moment to acknowledge the loss of a titan of state government, former Governor Jim Thompson. As the longest-serving governor in Illinois history, Big Jim walked the walk on bringing people of all political stripes together to make life better for the people of this state. He lived a big life and he got big things done, important things done for the people of Illinois. But perhaps most importantly, he was a kind and decent man who set the standard for what public service can and should look like in our state. I have spoken with his family and his friends and offered MK's and my condolences. And on behalf of the people of Illinois, I want to ask for a moment of silence here today to honor him and to let his wife, Jane, and his family and the many friends and colleagues of his know that all who knew him will mourn his loss. Thank you. May his memory be for a blessing. To help honor Governor Thompson, we are launching a virtual guest book that will be shared with his family. Anyone is invited to join in signing the guest book. You can visit illinois.gov/GovThompson, GovThompson, to add your name and share your favorite memory of our former governor. And now to today's update. As of yesterday, Region 4 of our 11 Restore Illinois regions, that's the Metro East region, is operating under stricter mitigation requirements after surpassing an 8% average positivity rate for 3 days in a row. And as of yesterday, the region now stands at a 9.4% positivity rate. The Illinois Department of Public Health worked closely with local officials in the region and counterparts across the Missouri border in St. Louis to put in place Tier 1 mitigations that account for the unique characteristics of the region. IDPH will be monitoring the region closely over the next 2 weeks, and if the positivity rate remains at or above 8%, Region 4 may be subject to additional mitigations, such as the full closure of indoor bars and dining. As Dr. Ezike and I have said throughout the COVID-19 pandemic, facts and science will continue to determine what efforts Illinois should make to protect our people. If the data shows the virus is spreading at a high rate, like we're seeing in Region 4, we won't hesitate to tighten restrictions to protect our communities. Your health and safety is my paramount concern. I'll remind everyone that in addition to the 3 days of an 8% rolling average that Region 4 triggered, a return to tougher mitigations can also be set off by 7 days out of 10 days of increasing positivity rate plus a sustained 7-day increase in hospital admissions. The regional specifics of the tightening of mitigation efforts will be determined and dependent upon the types of activities that are most likely causing or could cause greater community spread of the virus. Across the state, our 11 Restore Illinois regions are trending in different directions, the majority of which are the wrong direction. Comparing yesterday's data to a week ago, Region 2, 3, 4, 8, 9, 10, and 11 have all seen an increase in their 7-day rolling average positivity rates. Only Regions 1, 5, and 6 have seen a slight decrease. We're closely monitoring all 11 regions of Illinois, but in addition to Region 4, we're seeing troubling trends in Region 7, which includes Kankakee and Will counties, and Region 5, which represents Southern Illinois. I want to emphasize again that local elected officials and health officials should pay close attention to the data for their communities and, where necessary, should step up and impose greater mitigations on a targeted basis to bring down the number of infections and positivity rate. Otherwise, it may only be a matter of time before the state will be forced to step in on a regional basis in other areas and impose resurgence mitigations like closing bars, indoor dining, limiting all indoor gatherings to even smaller capacity, and more to reduce the spread of the virus. All of you at home and at work can also do your part. One of the principal reasons that Dr. Ezike and I come before you regularly to give you the latest infection numbers is because I want you to have all the facts so that you can make the best choices for yourselves, for your families, and for your communities. You can check your county's most recent metrics every day on the IDPH website. And this week we rolled out travel guidance with an interactive map, another resource for individuals to reference as they make decisions about travel, whether work-related or for leisure. We're all in this together, and we're all safer and stronger when we go all in Illinois. Thank you, and I want to turn it over now to Dr. Ezike, our Director of the Department of Public Health. Doctor?
All right, thank you so much, Governor, and good afternoon, everyone. During each press briefing, I provide an update on the number of people who have contracted COVID-19 newly, those who've been hospitalized, those who are in the ICU, those who are on ventilators, and most painfully, those who have passed on. I'm concerned that we've grown numb to these numbers, and we need to remember that they're not just numbers. These are people. These are loved ones who were so sick that they were hospitalized in the intensive care unit and unfortunately succumbed. In March, when we started seeing evidence of just how deadly this disease could be, we did what we had to do. We stayed home, and when we couldn't stay home, we took the necessary precautions. We wore face coverings, we kept our distance, we kept washing our hands. We're now in August, and people are tired. They're tired of staying home, they're tired of wearing face coverings. But again, as I've said, the virus is not tired. This virus didn't change. Its tactics are the same and its practices are the same, but we can't change ours. We have changed our activity, and yes, we had to get back to doing some things. We couldn't stay in the house until the virus or the vaccine came, until the cure or the vaccine came. But what we do need to do is approach our activities in a way that it can be safer for us. And that will make the difference between being in a high-risk situation and a low-risk situation, between being in school in a classroom or school on Zoom, and potentially life or death. Some people seem no longer worried about the severity of the disease and are willing to sacrifice not only their health, but the health of others around them or even people they don't know. Please, let's think of everyone, and let's think of the people that we can save. Today, we are reporting almost 2,295 new mothers, fathers, daughters, sons who were newly diagnosed with COVID-19, and regrettably, 25 additional lives lost to COVID-19. This brings the total number of individuals in Illinois to 211,889 and 7,806 individuals who will not be at Thanksgiving dinner this year. 1,519 people in Illinois were reported to be in the hospital as of midnight, with 334 patients in the ICU and 144 patients on ventilators. In the last 24 hours, more than 50,000 lab results, our highest total ever, have been reported for a total of over nearly 3.5 million tests that have been performed since the beginning of this COVID pandemic. I've heard people say that the numbers aren't that bad, they're only increasing a little, we're better than other states, we don't really need to be that strict. The truth is we are better than most states, but that's true today. But we are going in the wrong direction. The country as a whole, for 4 weeks in a row, the positivity rate has declined. For 4 weeks in a row for Illinois, the positivity rate has increased. This is precisely the time that we have to act. We want to prevent from getting into a very bad spot. We want to be proactive and not be chasing our tail as it spirals out of control. Prevention is always the best plan, but we know that there will be infections despite our best efforts. So what else can we do? I'm often asked that. I'll tell you, like I would tell my adult patients if I were still at the Austin Health Center or Stroger Hospital or the Cottage Grove Clinic. I'll say, be your healthiest you. So if exercise and eating right is not getting your blood pressure to goal, take the blood pressure medicines that were assigned to you. Check your sugars like you're supposed to if you're diabetic, and do what you need to do to get your sugars down. Walking can absolutely be a safe activity, even in these COVID times. Walk for your blood pressure, walk for your diabetes, walk for your anxiety, walk for your depression. It's good for all of that. Take care of you so that if COVID strikes, and I pray that it doesn't strike you, your best you will be there to fight. And to my pediatric patients, I tell them, and I tell their families, please schedule your health maintenance visits. Get all your shots up to date. And to every single body, I say, plan to get your flu shot as early as possible. We have not seen what flu and COVID illness looks like together, and I'm sure we don't want to. Please get your flu shot as soon as it's available. Continue the 3 W's, wear your face covering, watch your distance, wash your hands. The sooner the better, and we can all get back to some semblance of normalcy. We are all in Illinois.
And if you haven't already, please consider subscribing to our channel. And while you're at it, please leave us a comment. Thank you for watching.